Now, let's get started with Norma Verticalis. If we talk about Norma Verticalis, where it is situated, how it appears, for that, we have to see it from above position. When it is seen, it appears oval, which is wider posterior than anterior. Okay, skull appears oval in shape, right? Skull is not made of single bone. Then what are the bones included? Let's see. When we move from anterior to posterior, first bone that we get is upper part of frontal bone, 2 parietal bone, and 1 occipital bone. If there are bones, then there must be joints. In skull, bones are joined by sutures. Then what are the suture present? See, first suture is the coronal suture that is present between frontal bone and 2 parietal bones. Second one is sagittal suture that is present between 2 parietal bones. Third is lambdoid suture that is present between occipital bone and 2 parietal bones. And here comes the last suture called metopic suture that separates frontal bone in 2 halves. It is fused at the age of 6 years and it is present in 3 to 8% of individuals. So now let's move on to the next part, that is some other features or characters of Norma Verticalis. First is vertex. Vertex is the highest point of sagittal suture. Secondarily, bregma, which is the junction point between coronal suture and sagittal suture. If you see in infant, it was the point of anterior fontanelle, whereas lambda is the junction point between lambdoid suture and sagittal suture, and it is the point known as posterior fontanelle in infants. Lambda closes at the age of 2 to 3 months. Moving on to the next point, it is the parietal tuberosity. It is the point or area of maximum convexity of parietal bone, which means most curved point of parietal bones. And now comes next point, that is parietal foramens, which are present on sides of sagittal suture, 2.5 to 4 centimeters above lambda. It transmits emissary vein that connects scalp veins with superior sagittal sinus. And obelion is a point on sagittal suture in middle of 2 parietal foramens. And now here comes the last part of Norma Verticalis, that is temporal lines. Temporal lines are curved lines that begins from zygomatic process of frontal bone as single line, and arches backward and upward and arrives to parietal bone. Here it divides into superior and inferior temporal lines. Superior temporal line disappears at the posterior of parietal bone, but inferior temporal line arches downward and frontward and continues with zygoma.